This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, welcome to a new edition of Behind the Headlines. I'm Charlie Greenewalt, Senior Fellow of the Susquehanna Valley Center for Public Policy, and I'm joined, as usual, by my co-host, Maura Donnelly. Maura, welcome to the show.
Hello, Charlie.
Why, the summer progresses and the polls are narrowing. It seems like last poll I saw, Governor Corbett was down by a single digit, by 9%.
It's narrowing. It's getting very close. It's going to be an interesting fall.
Yeah, I think it certainly will be. And of course, we find continued discussion on many subjects on the Hill. And of course, one of them is, of course, medicine and hospitals and hospital care in the Commonwealth of Pennsylvania. And for that, today we have a very special guest. We have today with us Michael Consuelos, who is the new leader of HAP. It's the Hospital Association of Pennsylvania, a Hospital and Healthcare System of Pennsylvania. Is that correct?
Well, I'm not the new leader. Andy Carter is my boss still. So I'm the Senior Vice President for Clinical Integration at the association.
Yes, and we welcome you to Pennsylvania and welcome you to the show.
Thank you.
Could you tell us a little bit about your background, where you came from, and what your background is to prepare you for this leadership position with the hospitals?
Sure, Charlie. So I'm a general pediatrician by training. I had previously been at the Lehigh Valley Health Network there for about 13 years, and previous to that about 6 years in the Army. So during that time, not only was I a practicing clinician in pediatrics, but I also was involved in a wide array of hospital-based operations. So all the way from capital planning to business planning to physician group development and business planning. So there was also a lot of time spent in quality at the hospital, and so that's one of the things I'll be bringing here.
Well, Dr. Consuelos, is this a new position that the Hospital Association has created?
Yes, it is. So this is a very new position. This is an effort really to move the Hospital Association along with the rest of what's happening in healthcare, which is changing over to what we call the triple aim, as you may know, and part of that is to be much more sensitive to the patient experience and population health, and to improve quality and to make the entire patient experience a much safer and higher quality experience.
What will your top priorities be for your time here in Harrisburg and your time with the Hospital Association?
Sure, that's a great question. So I have several top priorities. One of them will be to continue to advance our quality efforts here in Pennsylvania. We have a hospital engagement network, which is a collaborative effort amongst our hospitals to improve patient safety. And another effort will be to improve our clinical integration in our hospitals. So what I mean by that is that traditionally care has been very episodic. So you get admitted to a hospital, something happens, and you go home, and then you follow up with your physician. Well, that sometimes can be somewhat chopped up and not very friendly to the entire patient experience and the family and the follow-up. So we're looking to integrate the care across the entire continuum. So that includes pre-hospital care in folks' primary care, through the hospitalization, and to include the specialists who may take care of the patient, and then post-hospital care, which may include a nursing facility, a rehab facility, or care in one's home. As you may know, a lot of the care is moving away from acute-based care and much more to community-based and preventive care.
Well, as you know, I've been a hospital patient. There's very few people that haven't at one point. How would I, as a patient, notice what would be the single difference I would see now that you're on board with the Hospital Association as opposed to my previous experience in the hospital?
Sure. Well, hopefully it won't just be one single experience. I think hopefully communication.
I hope it's one single experience.
Well, one improvement experience, yeah. So I think one of the things will be the communication of the medical information that pertains to your episode of care will be done in a much more fluid manner. Okay, so not only will your physician who takes care of you for that event will know what's going on, but the specialists who may be involved, but also your primary care provider and any other providers that you may have. That will also hopefully correlate to a better experience. So not just the health medical part, but overall your experience as a person. So we're thinking about our experiences as we enter other service industries, where it's not just about getting the health care, but the entire experience. So maybe anywhere from the food you eat, to how people interact with you, to the information you get about your illness. All of that is work that hospitals are working towards to improve care.
And will patients have a better sense of who to talk to once they go home? Because I think that's one of the biggest things. If something does go wrong or there's a follow-up question, you've dealt with an array of doctors and providers and nurses who to call and who talk to about what's going on.
Yes, that's a great point. So at the very basic level, we don't want you to get back in the hospital for any reason. So we're looking very deeply into how readmissions occur. So if you were to leave the hospital and if you were to go back in the hospital, we're trying to prevent those. So that's the primary goal. And then also, after you leave the hospital, how is your care taken care of? And we know that much of what happens after your care will help predict whether or not you get back in the hospital. And so currently the way the payment models are evolving is that hospitals are going to be at a disadvantage if that occurs. So there's financial levers that are being pulled there for that reason, but also it's the best thing for patient care.
As Senior Vice President of the Hospital Association, how does Pennsylvania's hospital system stack up against other states across America? How would you rank us?
So I personally don't rank them, but there are several folks out there who do that, and unfortunately, we're about average in many of the published metrics that are out there.
Are you going to change that?
Yes, it is. Okay. So one of our strategies is to improve quality, clinical integration, to work with consumers, meaning patients, to help improve their care. And so we want to move from about average into the top quartile and the top decile across the United States. So be up there near the top.
Is clinical integration the fancy word you're using for everything you described with the patient experience? Or
Yes,
is that something different?
Right, so it is sort of a catch-all, and for many people it means different things, but what it should mean is from the patient's experience, their care seems to be not chopped up into little bits. It seems like one continuous event. So it's like a fine, 8-course dinner as opposed to being served all kinds of random things. So maybe not the most appropriate analogy, but I think it drives the point is that it should feel like things happen for a reason.
I like that you're using this term patient care or patient experience over and over again. One of the things that can make the patient experience go really down is when the bill arrives.
Yes.
So I have a question for you. I'm not sure if this new position is going to be part of this, but there's study after study. You get an appendectomy in one hospital, it costs one thing, and you go down the street to another, and it's vastly different, higher, lower.
Right.
There's no common cost associated with that. Is any part of this new patient experience and clinical integration going to try to work towards I don't want to say standard, because there can't be a standard, but something that isn't so vastly different as it is right now?
Sure. So let me answer this question in a way that gets to your point. So yes, it's not fun to get a surprise in the mail for some sort of care, right? That you're the most vulnerable time in your life. You're worried about your health.
Right.
Your family's worried about your health, and really, that's not something that usually enters the calculus and in what we try to do, what you try to do. We don't look at costs in that manner. So there is going to be a big move. The other word you'll hear is transparency. So there are regulations and movements towards greater transparency over the next short time period, year to 2 year, for all hospitals and health system organizations. What that will do will, first of all, hopefully educate the patient population, the community, about what the pricing model looks like. One of the unfortunate parts of healthcare is that it's not like you're building a car, so you know what your cost is every time you do that. Every patient really is different, and so sometimes figuring out those costs can be quite a challenge. So that's not to excuse some of those differences, but each hospital does operate differently. They have different costs. They have different ways to manage their care. So some of those differences are inherent to the way that they're doing their care. Okay, and it really isn't the same thing. You can't really cross the board.
That's why I don't think there can be a standard price, but something that
Yeah, but unfortunately there's a standard payment. So
there is a standard payment.
Right.
Yeah.
So in payers and both private payers and the federal and state payment models, there's obviously standard payments, and we have to live within those means. So some of the pricing conversations are around that, obviously. But getting an understanding of our costs and also trying to drive our costs down as hospitals is very important.
Well, the transparency is going to be key to that going forward.
In the past, when I was with the Senate, we took a good hard look, and I know Senator John Peterson had been interested in the issue of rural health and rural health care. That it seemed to be fewer resources in rural parts of the Commonwealth. How are we doing presently in delivering healthcare services to rural Pennsylvanians, and what else needs to be done to address that?
Well, a couple things. So we have critical access hospitals. So hospitals who have been identified specifically in those areas that you mentioned, Charlie, where the resources are relatively limited. So part of it has to do with population density, and it's hard to attract and to support healthcare in those areas because it takes quite a bit of resources to put up a facility, to operate them 24/7. In trying to be good stewards of the community's resources, you want to adjust those operating expenses so that obviously the hospital doesn't go under completely. So you have to kind of manage that piece. At the state level, there's a commission that's been appointed looking at physician shortages, and specifically that commission, which I'm on, is looking at some what we consider not necessarily a shortage across the state, because as a state we're actually doing quite well, physician per citizen as a round number, but there's a maldistribution. So on average we're doing okay. But it's not just the rural areas. There are urban areas. There's sort of these primary care deserts. So where there isn't primary care, representing hospitals, there may be hospitals in the area, but really we hope that preventive care and primary care keeps people out of hospitals. And there's pockets in the large urban centers where people just can't get to primary care.
So let me ask you, just as we're winding down in our little segment here, what would make you take this position? You're a very successful doctor. You've come over to an administrative association. What personally, professionally, made you choose this new position?
Yeah, that's a great question, Maura. I think it's, as a physician, I've always tried to make people more healthy. And as a pediatrician, prevention and taking care of kids and seeing them grow up and have fulfilling lives has always been the most rewarding part of my professional career. I saw this position open up, and I sort of discussed it with people who helped me make decisions. And really, this is a way, I think, to translate my real life experiences, day-to-day experiences, both in hospitals, primary care, and managing patient care, and trying to figure out if we can translate that into something larger across the board. So we hope, the Hospital Association hopes that we are having progress towards a more healthy Pennsylvania, and that's my personal goal too.
Oh, that's great.
Okay, we want to thank you very much.
Thank you very much.
Spending time with us today,
yes,
and we look forward to having you back.
Great, that'd be great. Thank you.
We'll be back with segment 2 of Behind the Headlines right after this.
Behind the Headlines is brought to you as a public service by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Business Council, envisioning a commonwealth in which residents enjoy a very high quality of life in sustainable communities. The council works aggressively to define key long-term policy strategies and solutions to make the commonwealth more competitive, creating and sustaining a better Pennsylvania. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by Daily Express, transporting construction, farm, and industrial equipment throughout the United States, and by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org. And by Penn Waste, your best local choice for your waste removal and recycling needs.
Hi, welcome back to the second segment of Behind the Headlines. In this segment, Maura and I are going to be talking about highway construction and about transportation in Pennsylvania with a very knowledgeable person on this particular topic, Bob Latham. Bob is the Executive Vice President of the Associated Pennsylvania Constructors. Bob, welcome back to the program. It's nice to see you again.
Good to see you both again. Thank you.
Why transportation this particular year has taken on such an important focus in state government. It's certainly one of the major accomplishments of state government over the last year was passing the Transportation Infrastructure Financing Act, Act 89, and I know you played a large role in that. What does it look like for next year's funding and in the near future?
Well, Charlie, Act 89 was a historic event here in Pennsylvania, and I think it's a watershed event across the country as well. What we did for the first time, or what our elected officials did for the first time in Pennsylvania, was create a long-term, what we call comprehensive, in other words, plan. In other words, we didn't just fund roads, we didn't just fund public transit, we didn't throw a little bit of money here piecemeal. We looked at the entire transportation network as a system, looking at the importance of moving goods, moving people, particularly safely around the Commonwealth, not just, along the interstates or the major routes, but locally in your community. Funded that, and then looked at things like general aviation plans. In other words, what is you think, well, what's so important about that? Well, getting private planes in and out of places sometimes is very important as well. We looked at alternative transportation modes. Just look at some of the cities. Philadelphia, a lot of people are moving downtown now. They're younger people, the younger demographic are not as apt to own cars. So public transit is a very, very vital service to them, and this bill shored up funding for SEPTA, and not just SEPTA. And the public transit is more than SEPTA. It's in all 67 counties. So essentially, we have attacked every facet of transportation, and I think as a result, it was very helpful to all of the constituencies that were represented both politically and throughout state government, and that's why we had a very, very broad coalition of support.
Well, I've been reading that a lot of other states are trying to do some transportation funding, and they're not having as much luck with probably the bipartisan nature of what we were able to accomplish here in Pennsylvania. But what can other states learn from us?
Well, I think the one thing that they can learn is to dream big. In other words, go for the whole enchilada. Because when you dream small and when you think small, you don't get it, because usually somebody gets cut out. That's the first line of opposition, and then it kind of builds from there. Just a quick example: there was an initiative, a referendum in Missouri recently. They looked at a $500 million sales tax increase. It was going to be a short-term thing. It wasn't going to really solve anything going forward. It would fund a few projects, and basically the Democrat constituency, who wasn't going to get anything out of it, were opposed to it, and the Republican governor, who saw it as a tax increase that didn't solve the problem, was against it, and it failed. We didn't have that situation here. But we used to do things like that. We used to do things like that, and that's why I think that the act is somewhat historic politically. I have to give Governor Corbett credit for bringing all those people together at the end. The leadership on both the House and the Senate, Republican and Democrat, putting the votes together and getting this thing done. It was again, it was very historic. Now you say, okay, well, what does this all mean? What it means?
What does this all mean?
What does this all mean? Well, it means several things. It's going to mean that we will have an increase in funding for all the multiple modes of transportation I described earlier. Much safer roads in and around our communities. And a lot of the work, when we think about highway construction, we're going to think about some of these major projects that are going to be funded by this. So, for example, all those folks that are going to the Penn State games in the near future will have that great 4-lane highway all the way in, so that Potter Mill section up to the State College bypass will finally be completed.
When is that scheduled to be completed?
It's going to start construction next year and probably be finished around 2017, something like that. It's a fairly substantial project. Another major project through the middle of the state is known as the Central Susquehanna Valley Expressway in the Shamokin Dam area. We're going to do major tunnel improvements to the Fort Pitt Tunnel in Pittsburgh. I-95 will finally be connected to the Turnpike, and there'll be improvements on I-95 in the Philadelphia region. And you can kind of go on and on with improvements to 81 and so on and so forth.
What improvements are going to be made to the Fort Pitt Tunnel?
Have you been in it?
Not recently, Mara.
Well, I can tell you it's not going to be widened, but some of the entrances and some of that confusion, you know, that coming in and out of there, and of course shoring up the tiles and making better lighting and all that. Hopefully, it'll make a little bit better experience.
We can get a little crazy trying to get into it.
A little bit better experience.
You can tell Morris from Pittsburgh.
Getting in and out of there. Well, I mean, that's the whole idea of kind of improving safety and convenience and the ability to get around. The Parkway East and West will be again rehabbed on both sides of the tunnel, but a lot of the work that's going to be done are these smaller, you know, non-ribbon cutting type projects that are really going to impact people's lives even more so than some of these major projects, I think, because obviously most of your driving is in and around your community, so having a safer intersection, maybe putting a light where it wasn't before, maybe putting a turning lane in, a divider between, on some of these roads that where you've had some crossover collisions and things like that. Some of these little safety things, obviously, if they avert an accident, a fatality or serious injury, that's a huge impact on somebody's lives that they're happy to never have to experience. And then again, with this multimodal fund that was created by the Act, we will see opportunities for pedestrian and bicycling and other modes of transportation other than motorized as well.
When I hear about all these projects and the millions of dollars that are going into it, the first thing that comes to my mind is, I do like things to be all about me, but sometimes not. It actually is jobs, and I know that they're being mentioned in passing in a lot of the materials, but I don't think that the jobs that this is creating is getting enough play. Can you tell us a little bit about it? It's got to be significant.
Well, it is, and the most significant part of it is not necessarily the construction and engineering jobs, although I would say that that's pretty important.
Right.
Pennsylvania boasts some of the finest engineering schools in the world. We have, Carnegie Mellon. We have the Penn State Engineering Center. We have University of Pennsylvania, and on and on and on. And what we've been doing is exporting our best and brightest out of here because there was nothing for them to do. So between the energy industry now and now the civil engineering, there will be more job opportunities. We also, in the construction side, we're opening up a lot of opportunities to returning servicemen and women who come back from Afghanistan and Iraq with skills. The Corps of Engineers and people that they have to do a lot of building and stuff over there, and then they come back. Well, we have opportunities for them. But most importantly on the job aspect is for our manufacturing industry and other industries, because when you take a survey of CEOs and employers, what they look at locating a business in some place is, number one, in some cases, is what's the transportation network? Can I get employees in and out of this facility, number one, and can I get product in and out of it to market? That's just as important, in some cases more important than the tax structure or other considerations. So, obviously, if you're going to locate a facility workforce, and can your workers get there? So we can now say, as a matter of fact, I was talking to former Governor Ed Rendell the other day, and he said, the whole time I was governor, I had companies that would come and say, I'll locate if you could put a spur in, rail spur in, or if you could put an exit or a slip ramp. And he said, we didn't have the money to do that in a lot of cases. Well, now we do, and now we will, and we'll be able to attract those businesses.
So there's gonna
that's the job creation aspect.
I would say it's going to be much broader than just the jobs that it's creating for the work.
Exactly. I mean, we had a economic study done for us that showed that this bill would create 50,000 jobs, and most of them are not in engineering and construction or material production or aggregates and all that. It's in these other areas.
Well, being from South Central Pennsylvania and Southeastern Pennsylvania, one of the problems that we have with transportation in this area is, of course, sinkholes.
I don't have a solution to your sinkhole.
Well,
pour more concrete into it, I guess, is really all they can do.
Well, one of the interesting things that's being done in the region, not so far from Hershey, is there's a sinkhole bridge being built. The sinkholes being filled in, and then large structural steel supports are being put over the sinkhole and under the road. Is this something that the contractors, the constructors have thought of? Or is it going to be used other places, or is this a unique situation for this one location?
Well, certainly the private industry partners with PennDOT, and PennDOT has many fine engineers who work for them, and then there's the private sector as well that we have. Again, we have tremendous engineering firms throughout the Commonwealth, so I think when we have a issue like that, we have our best and brightest. They sit down and try to figure out a way to solve it. Yeah. Some of the feats that have been in transportation in Pennsylvania over our history are phenomenal. This year we're celebrating the 75th anniversary of the Pennsylvania Turnpike, for example.
Is there a party?
Well, yes, there'll be a little bit of
I want to make sure that we get some information to our viewers before we end here today.
Absolutely.
Can you let them know? Yeah, can you let everybody know where they can go for additional information about the projects?
Yes, we have a website, www.pahighwayinfo.org. That's our sort of policy website for our association, so you don't get hung up in all the construction stuff that's for our construction members. But you can find out all about the projects that are coming out as a result of Act 89's funding, where they're going to be in your area. That's broken down by county, and also sort of the time frame in which they'll be built.
Okay, thank you very much, Bob. We enjoyed having you with us.
You bet.
Thank you for all the good information, and we will look forward to seeing you and being with you again next week on Behind the Headlines. Maura and I will see you then.